We're very ready for April 2014. We're going through every day meetings discussing how are we going to move, what do we need to add, what do we need to do as far as training goes. Those plans are being well developed. We're going to be opening in April 2014 with 56 beds, and we're going to then add the additional beds. But you'll see the structure for the entire 112 beds when the hospital opens in April 2014. The hospital will be 8 stories tall. It will consist of about 250,000 square feet of hospital space, plus there will be a second medical office building built that will be 80,000 square feet. We're going to have 40 emergency exam rooms in our emergency room. That's compared to 15 that we have today and are operating out of today. So that's tremendous growth in our emergency room volume capacity. And then we're going to open with 4 surgical suites compared to 2 that we have today, but we have the capacity to go up to 6. I think some of the features that I'm most excited about in the building itself is all the sunlight that we're going to bring into the building. We have a glass atrium that connects the 2 medical office buildings with the hospital. We have a glass atrium at the end of each patient floor for family waiting space. We have standardized patient rooms. Every room is built exactly the same. That way when a nurse goes in to care for a patient, they know where everything is at. It's standardized. We're doing a geothermal heat pump. This is very unique in hospital settings. We're going to be allowing the earth to heat and cool the hospital rather than big machines as you see at most hospitals.
Well, we are at the Paulding County Services Building. They were so kind to give us some space. It's kind of like a warehouse space so that we could mock up our patient rooms so that we could test them to see if they would do what we expected them to do or per the design. Everything that we have done at the patient rooms, we went back to our guiding purpose and our guiding principles. We said that we would be the safest hospital in the world. We use safety to the 4th power, meaning that we would be safe to our patients and families, safe to our staff, safety to our community, and safety to the environment. We know by research that when you build in standards and eliminate variation, that the process is more safe. These rooms were totally created for patient-centered care, taking into consideration what the patient needs, putting the patient first, and also knowing that the family is an extension of the patient, so bringing them into a patient-family focus. Here you will see at our head wall that we have a very different looking head wall. You do not see the gases here. They're hidden behind the head wall here to give the patient more of a home feel or a hotel feel and not a clinical feel. We believe in the 6-second process where the nurse does not have to travel more than 6 seconds to be able to have the supplies she needs to take care of her patients. Another area is just behind me is the family zone. We've taken a lot of time to develop that family zone to be comfortable and attractive for families, but also for the patient, so that the patient will want to be out of bed and visiting with their family members. You'll notice the big, large window behind us. That's to bring in natural light. That offers healing to the family and to the patient. In the room, we'll also have a big 42-inch TV that will be much more than an entertainment device. The patient will be able to order their meals from using that TV. The family can use that as a communication device with the physician. He may call into the room and they will be able to see him on the TV and he can explain what's going on. The physician, when he's making round, can also pull up images, x-rays, tests on the TV and be able to explain and do a show and tell of clinical findings. Another component of our patient family-centered care is our decentralized nursing model. Instead of having a big nurses station out in the middle of the unit where all the nurses congregate, we have developed individual nurse workstations out by each patient's bedside. It's to move the nurse closer to the patient.
The new hospital and the medical office building will bring about 500 new jobs to the community. The hospital will be about 300, the new medical office building 200. Both of these will be opening pretty much at the same time, so that's going to be a huge economic impact to Paulding County. We're excited about opening a new hospital. This is very unique in the United States. There's not many new hospitals. This is a real opportunity for us to build something that is going to be innovative. It's going to really set a mark for the hospital industry on how new hospitals are built in the future, and we're just excited about being a part of that. We've been able to create an environment at Paulding Hospital today that we're going to take to the new hospital that is performing world-class quality health care.